Hello, my name is Jose Miranda Velasquez. This video is for BSN 225-21. The video is drawing up insulin video. Wanted to point out I'm using my phone to record and a tripod, so please bear with me if I have to make minor adjustments. My equipment's already used as I've been practicing. Okay, I'm in my Nightingale scrubs. You can see my badge. My supplies for this video are my gloves, 2 vials, 2 alcohol wipes, my syringe, along with my needle. To start my skill off, I need to verify the doctor's orders for this patient. Once I have done that, I can go ahead and verify and move forward. At this point, I will verify the 6 rights of patient administration. The 6 rights are the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. After, I need to do verification checks of the medications with the EHR. This is the first step to verify the medication with the MAR. I need to check a total of 3 different times before I can administer any medication to the patient. This is 1 out of the 3. The medication order for this patient is insulin. The order states to give 4 units of regular insulin and 8 units of NPH, intermediate insulin. I will be giving a combination of the 2 medications into 1 injection, equaling out the total of the 12 units subcutaneously for my patient. I will gather, once I'm done, I will gather my supplies and head towards the patient's room. From this point, I would knock, enter, close the door behind me to ensure patient privacy and avoid any HIPAA violations. I'd set my supplies down on a clean, dry, flat surface, perform hand hygiene, and introduce myself to the patient. Hello, my name is Jose. I am a nurse here. Can I have you state your name, your date of birth, and medical record number if you know it, while checking the patient's wristband almost simultaneously. I need to verify 2 patient identifiers for each and every single patient. Thank you, Mr. Miranda. Are you allergic to anything that we're not aware of? Nope. Thank you. At this point, I can go ahead and proceed in verifying the medication with the MAR. This would be the 2nd verification out of the 3. Once I'm done, I would perform hand hygiene and put on my gloves. Then go ahead and start communicating with my patient. Make sure I'm recording here. Your doctor, I would communicate with my patient here. Mr. Miranda, so your doctor ordered you to have some medications. There are 2 sets that you're going to be receiving in 1 injection today, okay? The first one is regular insulin. It's short-acting insulin, and the mechanism of action is that it draws glucose from the blood into the cell and uses that energy to then lower your blood sugar. The use of this medication, it covers the insulin needs. The insulin needs for meals. It's short-acting and it will only cover for about 30 to 60 minutes, essentially. There are some common side effects for this medication. Those can include hunger, shakiness, and anxiety. There are some adverse reactions we don't want or expect to happen. They can include tingling of the lips, seizures, and sometimes even tachycardia, where your heart starts to race. If there's any adverse reactions that do take place, please let me know. We'll let your doctor know immediately. The 2nd medication is going to be an immediate NPH insulin medication. It has the same mechanism of action. It lowers your glucose levels, and then the use of this medication, it covers your insulin needs for about half a day, so the coverage is a lot longer. After long periods of time, the side effects could be weight gain, water retention, or excessive sweating. Some adverse reactions, same as other, we don't want to happen, but they could range from generalized weakness to headache, even confusion. Again, if you start to experience any of this, please do let me know. We'll let your doctor know immediately. Also, these injections, once I administer them, I plan to come back and check on you, but if I don't, please hit the call out and I will come immediately. Or if I don't come by as quick enough, if you start to feel these things. Also, I want to let you know, so it doesn't catch you by surprise, that once we administer the medication and give you the injection and administer the medication, you'll feel some slight stinging, burning sensation, which is normal. I want to let you know and make you aware of that, okay? you have any questions for me? Nope? Perfect. Okay, so at this point, I want to go ahead and verify my medication with the MAR for the third time. And this will be my third and final time. Additionally, I want to get the patient's glucose levels. I want to check their blood sugar so I can determine when the next meal is and then how much insulin to give, of course. I do want to state that although I have verified the medication in the MAR 3 times already, there are cases where I'll have to verify the medication more than the 3. So for this point, I would have another nurse nearby so that we can both verify the amount of each and then the total amount of the insulin with the MAR, and then we can proceed with administration of it. So I just want to reiterate, my patient will be receiving 4 units of insulin and then 8 units of intermediate NPH insulin, which make it a total of 12 units of insulin altogether. So for this, I will draw up air for the intermediate insulin. I will then be injecting it into the vial, attempting to not draw up any of the solution, which is what we want. I will be drawing up air for the regular one and then injecting it into the vial. Then I will draw up the solution after of the intermediate medication, or the regular insulin. Okay. So at this point, I want to take my NPH insulin and roll it in my my vial and roll the medication in my hands. At this point, I want to clean the top of the vials with the alcohol pads. I will discard of the wrapper, put it in my trash. I'll take a second alcohol prep pad and clean the top of the vial with the alcohol pads. Okay, then I will remove my needle from and the syringe from the plastic. So for this first one, I will be drawing up 8 units of intermediate insulin. The nurse and I will verify the process and the orders with the MAR. Okay, so I have 8 units of air that the nurse and I will verify against the MAR. So let me draw my 8 units of air. We'll show that to the camera. Very hard to see here. So I will then remove the cap and get my vial of NPH. Leaving the vial on a flat surface, I will administer the 8 units of air into the vial. I don't want to touch any of the medication or draw up any of the fluid. Okay, next is the 4 units of air for the regular insulin. Okay, for the units of air, both the nurse and I will verify that with the MAR. I will be injecting the air into the second vial of the regular insulin, and I will inject the air after I'm able to draw up the solution. You can see that here, the 4 units. Okay. At this point, I will pick up the vial, invert it, and draw 4 units of insulin. I can tap to remove any air bubbles. If I need to, I can push all the insulin back all the way into the vial and then redraw as well. Okay, the nurse and I will both verify the 4 units with the MAR. And I will show the 4 units to the camera here. Very hard to see. Now I can get the intermediate medication, but I need to ensure that I don't mix any of the regular medication into the vial. No. So yeah, I don't want to add this to the other vial. I want to just draw it up. And additionally, I want to ensure that I don't overdraw. So yeah, sorry, a little brain fart there. So I don't want to mix them. I just want to draw, and I don't want to overdraw either. So I have 4 units, and I'm gonna draw 8 units of my NPH. I have my 8 units. If there's any bubbles, I wanted to reiterate that and point that out. If there's any bubbles, I can flick it, or push the insulin. Well, in this case, I can't push it because I have the other insulin in. I don't want to cross them in the same vial, but I can just tap the syringe to get the air bubbles out. I didn't see any air bubbles in this circumstance, so I didn't do any of that. Okay, so I had 4. My totaling dose is for insulin that needs to be 12. So I drew up 8 units of my NPH. So, okay, total 12, and then so my nurse and I will verify that with the MAR. I already withdrew my needle from the vial. I tapped on the syringe, the first time around. Like I said, I didn't see any bubbles the second time, but if need be, I can tap on the syringe to ensure the air bubbles taken out. Carefully, I will recap the needle using the swoop method, where I will pick up the cap using the needle. And this is to ensure getting poked. So, for the final and last time, I want to verify the medication with the MAR. This is the 12 units of insulin for my patient. And this is very hard to see. Okay, medications are ready to go. Let me go ahead and put that down. I wanted to point out that if I was preparing the medication outside of the room or away from the bedside, I would be labeling my syringe with the patient's name, the dosage, and the amount, so that if I were to mix the syringe, I can point out who it belongs to, and then move forward from there. So, yeah, pretty much it. Thank you, and scene.